Equipment: antiseptic pads, 70% alcohol or alcohol-based chlorhexidine. Povidone iodine may be used if a contradiction to 70% alcohol or chlorhexidine exists. Gloves: family string containing sterile normal saline. Tourniquet: short peripheral catheter with the appropriate size. Prescribe IV solution or medication with a tag and prime administration sap. Procedure: gather and prepare the necessary equipment and supplies. Perform hand hygiene. Hang the IV solution or medication with a tag prime administration sat on an IV pole positioned close to the patient's bed. Place the patient in a comfortable sitting or reclining position, leaving the arm in a dependent position to increase venous flow of the lower arms and hands.
Good morning, sir. My name is Alia, and I'm gonna be your nurse today.
Confirm the patient's identified using at least 2 patient identifiers.
Can you say your name and your date of birth, please?
Explain the procedure to the patient and family, if appropriate.
So it's going to be IV catheter. I'm going to insert the IV catheter for your medication, and it's going to be on your arm.
Applying the tourniquet. Apply a tourniquet on an upper extremity to dilate the veins and assess for an appropriate insertion site. Apply the tourniquet loosely or avoid its use in patients who breathe easily, are at risk for bleeding, or have compromised circulation or fragile skin. Assess the patient's veins in the upper extremity and identify potential sites that are easily seen or palpated. Preparing the site. Prepare the insertion site using an antiseptic agent. Apply the agent using a sterile, single-use applicator. Allow the solution to dry completely without fanning, whipping, or blowing on it. Inserting a peripheral catheter. Stretch the skin below the puncture site using the thumb of your non-dominant hand to stabilize the vein. Tell the patient that you are about to insert the device. Place the short peripheral catheter on top of the vein at a 10 to 15 degree angle to the skin. Puncture the skin and anterior vein wall, watching for blood to appear in the catheter. As you continue to hold the skin, advance the catheter into the vein. Don't advance the catheter by pushing from the catheter hub to avoid contaminating the catheter hub. Release the tourniquet. Dressing the site. Apply a transparent semi-permeable dressing over the insertion site. Assessing catheter patency. Unclamp the catheter and begin the infusion as prescribed. Monitor the insertion site for swelling. Remove the catheter if swelling occurs or the patient complains of discomfort or pain. Label the dressing with the current date and due date to be changed. Use a joint stabilization device, such as a padded arm board or splint. Intravenous catheter removal. Implementation. Verify the physician's order for removal of the IV catheter. Gather and prepare the necessary equipment and supplies. Confirm the patient's identity using at least 2 patient identifiers.
Could you please say your name and your date of birth?
Explain the procedure.
So now I'll go to explain the procedure. So I will gently remove this on your hand and withdraw the catheter. It's gonna be a little bit hard because I will press your hand with the gauze. Is that okay? Okay, now let me prepare everything.
Perform hand hygiene. Put on gloves to comply with standard precautions. Trace the IV administration sat tubing from the patient to the point of origin to make sure that you are assessing the proper IV administration sat. Clamp the IV administration sat tubing, the extension sat, or pot to stop the flow of IV solution. Remove the transparent dressing by gently pulling the dressing edges back toward the IV insertion site to avoid stripping or tearing the skin. While holding a gauze pad over the puncture site with one hand, use your other hand to withdraw the catheter slowly and smoothly, keeping it parallel to the skin. Apply pressure over the IV insertion site using the gauze pad until the bleeding stops for a minimum of 30 seconds. Tape a gauze pad to the catheter exit site or apply a small adhesive bandage. Discard used supplies in appropriate receptacles. Remove and discard your gloves. Perform hand hygiene. Document the procedure.